Welcome to the Prospective Doctor podcast, brought to you by Med School Coach. Pre-med and medical students alike are encouraged to tune in each week for tips on how to become a strong med school candidate, gain acceptance into the school of your dreams, and succeed on your journey toward residency and becoming a doctor.
Hello, everyone. Welcome back to the Prospective Doctor. This is Arkita, and I'm here with a very special guest, Dr. Shanedelle Norford. I just want her to tell us in her own words a little bit about yourself.
Well, thank you, Arkita, so much for having me. Like you mentioned, I'm Shanedelle Norford. I'm a forensic pathologist by training. I'm currently working as an associate medical examiner at the Orange County Medical Examiner's Office in Orlando, Florida. Originally from the Caribbean, the island of St. Kitts, but have been living in the U.S. for over about 13 years now. I left my home, St. Kitts, to pursue further education and has since been living in the U.S. I completed my undergraduate degree at the University of Virgin Islands. We obtained a Bachelor of Science in Chemistry. I then went to medical school at Boston University School of Medicine, where after which I completed a 4-year residency program in anatomical and clinical pathology. And finally, I completed my forensic pathology fellowship at the Miami-Dade Medical Examiners Department.
That's awesome. If you guys didn't hear, she shouted out Boston University School of Medicine, and we actually went there together, so we're fellow terriers.
Yes, we
are. I'm interested to hear, why did you choose the specialty of pathology?
I'm sure. In medical school, I actually considered several specialties. I considered OBGYN. When I first entered medical school, I actually wanted to do either cardiothoracic surgery or neurosurgery. But one thing I realized about clinical medicine is that it focused predominantly on the what. That is, it focused on the diagnosis and treating that particular diagnosis. But I found myself having more questions about the hows and the whys. That is, how and why a particular disease developed, and the pathology of that disease. So I found myself actually interested in the mechanisms and the pathophysiology of particular disease processes. And pathology was where I found most of my answers. Pathology allowed me to get to understand disease on a much deeper level. And it's actually quite interesting because in pathology, you realize that every single cell tells a story of its own. And it's kind of like putting pieces of the puzzle together, which makes it pretty interesting.
That's so cool. I can totally see how medical school does focus on, like you said, treating and diagnoses. And we learn all of those things about pathophysiology and how the body works and things in the early years, in the preclinical years of medical school. But you actually get to apply these things every day and in your life and in real time and action.
Exactly.
So pathology is not a core rotation in most medical school curriculums. How would you suggest students obtain exposure to pathology to see if they like it?
Unfortunately, most students don't get exposure to pathology at all. It's something that students have to seek out if they want to experience it. Most medical schools, however, do offer elective rotations in both general and forensic pathology. So I think students just need to be aware of that and then go and seek out those opportunities.
How would they seek them out?
So it's funny, and my story of getting in pathology is quite interesting. I remember actually during my first year of anatomy class, one of my preceptors said she wanted to go into pathology. And I remember thinking, why would anybody want to do that? That is so morbid. But, several years later, look at where I am. And for me, I actually in my second year, I remember talking to Dr. O'Hara, who was one of our Heme Path attendings. And he actually alerted me to the fact that they did have a pathology elective just across the street, and it was open to 3rd and 4th year medical students. So once I was able to take electives, I actually quickly booked my first elective was pathology. And I loved it so much because it was like a breath of fresh air. It was different from the realm of clinical medicine. Everybody was more chill, more relaxed. Everybody was happy. And it was really nice to be in that kind of environment where they encourage you to develop, to learn, and to ask questions. You didn't have to be afraid. Everybody was really interested in your learning, and I loved that. And then after that, I actually found out that BU also had a forensic pathology elective. And after taking that forensic pathology elective, I was sold on pathology. The weird things, I remember one Monday morning, I actually went in to work. There were 21 bodies in the morgue. And I remember saying to myself, you know what? I literally feel at home right here, which is kind of weird, but that's when you know.
That is definitely when you know, because I can never remember in any time in my life where I walked into a morgue of bodies and said, oh, this feels like home. But that does show the students out there listening, like there is a specific field and path for everyone. And as you try things out, you'll realize like what you're drawn to and what you can live with and what you want to learn more about and explore those options.
Exactly.
With the exploration of those options, what would you say would make a good pathology student kind of like shine on a rotation?
I would say a student that shows genuine interest, not one that just comes in and wants to leave like at 2:00. Someone who takes initiative, someone who shows up on time, someone who's engaged and asks questions and actually remains engaged for the rotation. Because, pathology rotation is actually pretty laid back, and actually just showing up and showing that you're genuinely interested and engaged actually goes a pretty long way.
That's true. And I think that can reign true for any rotation. You're only there for a certain amount of time. And it's one of the sometimes last opportunities that you'll have to have a one-to-one mentor with your attending or your older residents or other medical students, where you can just immerse yourself in a specific specialty and learn everything and observe everything that you can get out of it. So even if you decide not to pursue that particular career path, you'll be able to pull back on that. And in the future, you may be like, oh, I haven't done OB in 20 years, but I do remember like this is exactly, vaginal bleeding isn't good. So something like that.
But you know what, exactly, like this is your turn your time to learn. So just take advantage of it, because some rotations you may never see again, but you never know when you might need to draw on that particular knowledge in the future.
Absolutely. And moving into the current times now, outside of your past trainings and things, now you're working as a forensic pathologist. How has COVID-19 affected your work life daily during this 2020 pandemic?
Yes. Oh, COVID-19, huh? Yeah, so COVID-19 has impacted the practice of forensic pathology greatly. Because actually, up until a month ago, most medical examiners' offices in Florida were responsible for certifying all COVID deaths in the state. And that put a huge strain on our resources as well as personnel. So much so that many people left because of the continued strain. And because COVID is considered a public health crisis, it definitely falls under the medical examiner jurisdiction. So we were responsible for signing all the certificates of persons who died from COVID, as well as bringing in and testing all suspected cases of COVID. And our caseload has greatly increased. We've actually experienced an increase in about 50% of our caseload from last year as compared to last year, that is.
Wow.
Not only that, but we actually have down a few doctors and we've lost a few forensic staff as well. So it's definitely been a challenge.
At Med School Coach, we know that getting into medical school is hard. In fact, 60% of pre-meds who apply to a medical school don't even get accepted. And if you want to get accepted into a top medical school, it's even harder. That's why more students than ever are turning to MCAT tutoring by Med School Coach. Our tutors are all 99th percentile scorers, have been through rigorous training, and can help raise your MCAT score by 12 points or more. You need every competitive advantage you can get to get into med school, so why not get one-on-one tutoring from Med School Coach? Our expert team will create a custom program just for you and help you master MCAT content where you need the help most. You'll raise your MCAT score. We guarantee it. Visit us online at medschoolcoach.com and use offer code PODCAST10 to save 10% up to $400 on a Med School Coach MCAT tutoring package. You can achieve your medical school dreams, and Med School Coach can help.
That seems like a lot. And you are kind of in one of the hot zones in Florida.
Yes, exactly.
Have you seen, at this point in time where we're taping, it's the beginning of the month in October. Where are we now in terms of like the COVID numbers and the effect on the state that you're in?
You know what? I mean, over the last several weeks, the COVID numbers were trending down. But more recently, we've been seeing a slight uptick in COVID cases. And my fear is that with fall literally right upon us, I mean, that increase is going to happen even more at a more significant pace. Not only that, it's going to be compounded with flu season. So I'm actually scared because COVID is going to be in its natural cold environment, and there's no telling, what can happen, unfortunately. So I think it's still left to be seen, but we just need to be careful and, be safe and just practice like good safety measures still going forward, not let our guards down at all.
Mm-hmm. I've seen some data from other countries like Brazil who have had flu season before us, and they've noticed that with wearing masks, that the numbers for flu season, like flu cases, have actually gone down. Do you think that there is a correlation with that?
I think so, because even now, like studies have been showing that the virus is now, spread by aerosols, or it's now airborne. So if everybody protect themselves wearing a mask, then we can definitely limit the person-to-person transition. And, wearing a mask is not a huge thing. It's actually a simple thing. So I feel like if we're going to do something simple that's going to be so effective in the long run, why not?
I totally agree. I think that our motto and on billboards and everywhere, they just need to have like, wear your mask, mask up. It's the best thing you can do to protect yourselves, protect your family members, your community, your patients. So hopefully we'll see more pushing that nationwide. I know here where I am in the Maryland area outside of DC, there are a lot of groups advocating for that and a lot of people actually adhering to the suggestions. But I know each state is different and we're all in this different state of the process, but hopefully we can come together.
Exactly. And one thing I'm happy about, is Florida has just been in the news so much just because of this mask controversy. But I am happy that in Orlando, where I am, that there's a mandatory mask mandate. It's not the same for the rest of the state, but for Orlando, it is. And I'm happy, but even so, like, my husband and I went shopping this weekend and, people were still outside, just like willy-nilly, just like talking, hugging, congregating without the safety measures. People still don't grasp like the gravity of the situation, unfortunately. Sometimes I want to just come to work with me one day. And it sounds morbid, but, and then you'll understand, why it's such important to take all the safety measures that have been recommended.
Absolutely. I feel like a lot of medical professionals are out here advocating for your safety so that we can see you, we meaning like the primary care doctors, and we want to keep you out of the emergency room, and we definitely want to keep you away from Dr. Norford. Like, we love her. She can come back to this podcast and teach us more about pathology and the process, but you probably don't want to meet her in the morgue. So encourage your family members to wear a mask. If you want them to listen to this podcast, even if they're not interested in medicine, it may be like, hey, there are other doctors out here telling you the importance, and she's seeing it every day, how her numbers, like she mentioned, have gone up more than 50% since last year due to COVID. My next question for you may be a little general, but we seem to be learning more and more about this particular virus each day. What amazes you about the pathophysiology of the coronavirus right now?
COVID actually has been a great mystery, and it still is, because unfortunately, so much of the pathophysiology is still not understood. However, this virus has the ability to affect so many organs and so many body systems at the same time, and that's scary. It not only affects the respiratory system, but it affects the GI system, the cardiovascular system, the central nervous system. And its effect on these systems can last for months. And it's definitely changed the way I practice. For example, because it's been known that COVID can cause a hypercoagulable state, I've been seeing lots of my cases with pulmonary emboli, and now we've actually been testing those cases for COVID as well, and a number of them has been positive. So I'm just like, it's not kind of like a self-study for me. I'm just trying to see if there's really a true correlation, as well as follow that progression as well. So unfortunately, still, because there's so much not known, like, we just have to be so careful and protect ourselves at every cost.
Absolutely. And I find that super interesting, like how COVID is a great imitator, kind of similar to like what our mentors and previous professors taught us about, like the AIDS epidemic in the 80s and early 90s, where if you could think of anything, it was so new, you just blame it on AIDS or HIV because it was a great imitator. And it seems like COVID is kind of transforming like that. And this next question, it can be COVID related or non-COVID related.
Got you.
But what is the most unusual case that you've ever encountered in your entire career?
You know what? I must say that I do get quite a bit of unusual cases on a daily basis. I'm not sure how graphic you want me to be, but it's a crazy world out there. And I can tell you so many stories. One issue that we've been seeing a lot of recently, for instance, like we've been having lots of increase in drug deaths, right?
Mm-hmm.
And because of that, like law enforcement is now going after and trying to prosecute the suppliers of these drugs, whether it be friends, family, or drug dealers. The issue that comes with that now is lots of people have been dumping bodies like all over the place.
Oh my goodness.
Whether it be like alleys, just like open field. And I had this one case where this guy actually buried his cousin in the backyard. Look at your face.
I wish that you guys could see us like via video. I know this is a podcast, but I have the extreme look of despair right now and like fright. I feel like I'm listening to like CSI or something. So tell us more.
So his cousin, his 20-something-year-old cousin, died of a drug OD. They were all doing drugs in the house. And him and a friend decided to bury the cousin in the backyard and dug a grave 10 feet deep.
Wow.
Right? Not only that, you would think they would just leave it there. He goes to brag to the people in the community that, oh, my cousin's buried in the backyard. And most people were thinking he was joking, but when the police actually investigated and actually started digging, like literally, his cousin was still buried 10 feet under.
Goodness.
And interestingly, it had been a couple of weeks, but because he was buried so deep and it was like sandy soil, his body was like so well preserved. It was ridiculous.
That's crazy. I think maybe in the future you need to come up with like a podcast to tell us about crazy cases or something, or come back once a month.
But yeah, trust me,
imagine.
No, there are lots of crazy cases. Some of them are just big graphic, so I'll hold them back for now.
Thank you for that. I think that we're a PG kind of show. But it just seems so interesting that, like you said, you're a few years out of residency, and for you to still say every day you see something exciting or unusual, like that's something that makes you want to go to work. That's really cool.
Exactly. You never know what's going to come in the door. You never know.
At Med School Coach, we know that matching into the specialty of your choice and the residency program of your dreams has a dramatic impact on your career as a physician. And your USMLE score is the most important acceptance factor of all. That's why more students than ever are turning to Med School Coach for USMLE tutoring. Our tutors are all 260 plus scorers and have been through rigorous training. Plus, the average student who uses Med School Coach tutoring raises their score by 23 to 55 points. There is an enormous amount of material you need to know for Step 1 and Step 2, and Med School Coach can help you be smart about how to study. We'll create a custom program just for you. Then, we'll help you master USMLE concepts where you need help most. You'll raise your USMLE score. We guarantee it. Visit us online at medschoolcoach.com and use offer code PODCAST10 to save 10% up to $400 on a Med School Coach USMLE tutoring package. You can achieve your medical school dreams, and Med School Coach can help.
Is there anything that you know now that you wish you knew when you began your career in pathology?
It's funny, starting out, like I actually had no idea what pathology was. And, I had little exposure to pathology, like outside of like first and second year classes. Mm-hmm. So I wish I just had a deeper understanding of like pathology and exactly what it entails early on. And I wish I had more exposure to pathology early on. Because like, had I not had those electives, like I would have never been where I am today. And I always encourage medical students to, when I talk to them, I'm like, hey, if you do have a pathology rotation, try it out, because you never know. Even if you don't go into pathology, you might actually learn so much that might help you have a stronger foundation in medicine and your particular specialty going forward.
Absolutely.
And then, one other thing too that I took for granted was first year histology in medical school.
I know we took that together, so I just kind of blocked it out. But
I know. It's funny because I wish I had paid more attention, because even now when I'm like reading certain things, I actually think back to like Dr. Vaughn and certain things she would say. So like that knowledge is still so useful today. So I wish I had just like, laser focused and just pay as much of attention as I could have. But you never know where you might end up in life. And that's a lesson in that.
Absolutely. You're currently pursuing an MBA. Can you tell us a little bit as to why you're pursuing another degree in addition to having your MD?
Sure. Other than the fact that I absolutely love school and learning. I've realized that I've spent over 13 years going to school and preparing to be a medical doctor. But in all my training, I never received anything in administration, in business, or leadership. And I wanted to change that because unfortunately, many doctors struggle with the administrative aspects of medicine, as well as even starting their own businesses. And I never wanted that to be me. So for me, I actually wanted to fill the gaps in my knowledge and education and put myself in the best possible position to transition into an administrative role when the time presented itself. Because although I love being a forensic pathologist, I know ultimately I do want to get into administration and a leadership role, either as a chief medical examiner or in some other capacity. So I feel that just having this degree and this background knowledge in administration would definitely be a great asset for me in the future.
That makes complete sense because, like you highlighted, medicine is very important, and all of us who are listening hopefully will transition to become physicians, and our first goal is to treat patients and to learn every day. But even if you don't want to go into an administrative role, there is a business of medicine. So it may help if you go into family medicine to know what they're charging our patients or how they're coding things, because that becomes a big player in your compensation packages, like where they do, and we can talk about this on another episode, but sometimes you're paid according to what you see, or there are different ways as to how you can code and bill. And I know in my residency, they kind of hammered that into us. And I didn't really necessarily think that it was something that I needed to know. But when I got out there into brick and mortar practice, I realized that they were doing a good thing to teach us those things.
Exactly.
And then there are other things like contract negotiations. And if you're in the emergency department, knowing what they're doing and just knowing that background of the business of medicine, whether or not you do administration in the future or anything, will be very helpful.
Fully agree with that.
So you shined a light on so many things that I don't even think I may have wanted to know about, like pathology, at least the murder cases or whatever. I feel like I'm on like How to Catch a Murderer or something. But do you have any last words of wisdom to share with pre-med and med students as they prepare to proceed through their journey through the world of medicine?
Sure. I would definitely say, actually follow your heart rather than following the current trend. Because if you genuinely love what you do, then you'll not only look forward to doing it every day, it will never feel like work. I remember in my first year of medical school, tons of my classmates was like, oh, I'm going into Durham and I'm going to ophthalmology. And when you ask them, their reason was because it's easy and it pays a lot of money. But when you look at them today now, most of them are like so bored out of their minds. And as we know, like medical school and training takes a long time. Like the last thing you want to do is like, get into a career like 2 years down the road and be like, you know what, I hate this. And you actually want to switch residencies, because time is our most limited factor right now, and my motto is always like, do it right the first time. So, just like follow your heart, find out what you love and just go after it. Don't let anybody sway you from doing what you want to do. Don't follow the trends, just follow what you love. And, medical school and residency, they're challenging, but if you stay the course, your hard work and dedication will definitely pay off in the end.
Absolutely. I couldn't agree more. So I won't even add to that. I just want to really thank you for taking the time and talking to us and sharing your words of wisdom and your stories. And I just want you to continue to let us know more. But thank you for coming.
Sure, no problem. Thank you so much for having me. It was definitely my pleasure.
And everyone else, I'll see you next week with another guest, and we'll say goodbye now.
All right, bye-bye now.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward med school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.